Yeah, thanks for the introduction. I'm Levi, third-year resident. I'm up in Prince Rupert right now, so thank you all for joining me on Zoom after we had switched to in-person. So today I'll be talking about some work that a few of us have been working on over the past little bit about the urology workforce in BC. So we looked into things like wait times, workload, burnout among the staff here in BC. So before I start, I'd like to thank Dr. Locke for helping me with the project in general, but also this presentation today. So to get started, here is the kind of basic overview. So we'll talk about the different findings that we had, including the state of our current workforce, wait times, workload in BC. We'll talk about burnout and some possible maybe solutions and kind of restate some key findings from what we found. So to start with the overview, obviously you are all aware of what urology is and that it's a pretty diverse subspecialty of surgery covering a wide range of issues from cancer, benign disease processes that are seen in functional urology, endourology, andrology. Then there's obviously all the emergency cases. So need for these services is increasing as our population ages, gains weight. So we set out to see the current state of our workforce in BC so that we can gauge how we're doing now and how we'll be able to handle the increases in the future. So areas that we looked at specifically were the size of our workforce in BC, our wait times, our workload, our levels of burnout across the province. These were areas of interest were aimed at finding areas in the province that are in need of support urgently, and also to brainstorm ways to make sure our futures as urologists in BC is sustainable. And so in order to do this, a survey was conducted to kind of gauge all of that. So let's go over the details of the survey. So it was sent to all BC Urologic members from September 18th to October 8th in 2022. It was sent out by email. There were 60 respondents and a 92% completion rate of the survey, which is pretty good, I think. So the first things measured were demographics, so who we are collectively in terms of gender and age. So do most of us work in urban or community settings, that sort of thing. Then the meat of the survey really included the specifics around wait times, different workload metrics, and then burnout metrics. So wait times included numbers of patients on the office wait list, number of patients on the surgical wait list, non-urgent wait times, urgent wait times, and semi-urgent outpatient wait times. Workload included things like cystoscopy and ambulatory data, hours spent operating, both after hours and daytime, weekday work hours, indirect care hours, call frequency, and whether or not the calls actually required coming into the hospital or not. So it was fairly comprehensive. And then burnout metrics were measured with an agreement scale. So say one of those scales that's like heavily disagree, neutral, like one of those types of things. And it included statements like, I feel burned out, I feel emotionally drained from my work, and I have contemplated suicide in the last 2 years. So there was a bit more to it than that, but that was kind of an example of what went through on that part of the survey. So like I mentioned before, it was sent out to all BCUS members in the fall of 2022 by email. The responses were completely anonymous, and collected data was retrieved as compiled answers. So say you were a female urologist in a community setting aged 40 to 50, you couldn't be identified by exclusion, sort of thing. So everyone was grouped together. So that anonymity hopefully encouraged people to respond truthfully to the questions. So what did we find? To start with demographics, Gender, unsurprisingly, is overwhelmingly male, with 80% of the urologists in BC identifying as being a man. Just over 18% of respondents identified as female. And then in terms of age, most urologists are between 41 and 50. So this is the graph for gender, and then here's the graph for the age distribution. So a total of 38.3% of urologists in BC were over 50 in 2022. And then for practice settings, so we have mostly urban community practices with 58% of BC urologists saying that that is their current practice setting. This is compared to 25% in a rural community setting and 17% in an academic setting. So one possible drawback of the survey was the lack of actual definition around these terms. So they were left up pretty much to interpretation of whoever was taking the survey. So it's probably a good general overview of the spread of urologists in the province, but might not be super specific depending on what definitions we give these places. And this is important information because a lot of our population, just under half of BC's entire population, is outside of the 10 most populated places. So that's compared to the 75% of urologists that are in academic or urban settings. So with most of our urologists in urban settings, it's not really a surprise that many people living in more rural settings have to travel for their care. So this leads to significantly increased costs related to getting healthcare. And they have travel and accommodation costs. So those living locally in urban areas obviously do not have those costs. And I think Ryan actually did a really good talk on this last year. Across North America, it's been shown that those living rurally actually have less access to all types of surgical care. And specifically in urology, a study out of Saskatchewan did show that those who lived rurally were actually less likely to have surgery to treat their prostate cancer compared to those who lived in urban settings. So they opted more for things like radiation or hormonal therapy, just because of their distance and things like that. And then across medicine in general, it's been shown that there are higher rates of preventable and treatable mortality for those living in rural communities in Canada. Telemedicine has been able to improve access somewhat, specifically through COVID. That really amped up to increase access. And it has been helping, especially with things like follow-up appointments where a physical exam isn't necessarily needed, or in places like psychiatry or family medicine, where again, a physical exam may not always be needed for those visits. So switching gears a little bit, now I'll kind of talk more about our actual workforce in BC. So here in BC, the number of practicing urologists, or at least those that are in the BCUS, increased by 5 over 5 years from 2019 to 2014. Or sorry, from 2014 to 2019. So to give this a little bit of context, in the same period, there was an increase in BC residents by 670,000, or 134,000 new residents for each new urologist that came in during those years. When the stats were done in 2020, there were 1.8 urologists in BC for every 100,000 residents. So this is lower than the Canadian average, which is 2 urologists per Canadian. This can also be compared to physicians in general, where they found that there were 2.8 physicians for every 1,000 Canadians. I'll save everyone some math, but this is equivalent to 280 physicians per 100,000 Canadians, to kind of put that into the numbers I just said about urologists. So, of course, this is all types of physicians, and so obviously that should be much higher than per urologist, but just kind of some numbers to look at. So this brings us to our wait lists. If there are only 1.8 urologists per every 100,000 people in BC, how many of these people are waiting and how long are they waiting? So on average, each urologist has 277 people waiting to see them. There was a big range in the data though. So somebody had as little as 4 people waiting, and somebody had as high as 1,100 people waiting to see them. So it was quite a big spread. On average, there were 93 people waiting specifically for surgery per urologist. So how long are they waiting? Obviously, it depends on the urgency of their situation, but on average, patients waited 2.2 weeks to be seen urgently in clinic, and this increased to 6.3 weeks if it was semi-urgent, but was actually as long as 16 weeks for some urologists. The non-urgent clinic visits were actually not included in this part because they were waiting much longer. So some wait times for non-urgent surgery was an average of 8.7 months. So that's not even waiting to get the clinic visit, but the surgery for something non-urgent was almost 9 months. So why does this matter? Why can people not just wait forever? From a patient perspective, waiting sucks. Disease states can get worse. Nobody likes waiting. Dr. Karamudin at St. Paul's actually published a study in 2020 looking specifically at patient wait times and patient-reported outcomes. And they found that the longer the patients waited, the more pain they had preoperatively, or the more perceived pain they had preoperatively, the worse they reported their own health status, and the longer they stayed in hospital after they had surgery. So they actually had longer post-op stays as well. So this was done kind of after COVID times, which you're probably aware drastically increased wait times overall. So they were able to actually look at kind of the shorter wait times pre-COVID versus the longer wait times after COVID and how that affected the patients. So basically, nobody likes the long wait times, and actually, the patients perceive their health as worse when they're waiting long. So we're all working hard to see all of the patients that need to be seen to reduce these wait times. Urologists in BC specifically, on average, are working from around 7:20 in the morning to about 5:30 at night, approximately a 10-hour workday for an average of 62 and a half hours per week. Of course, this does increase for weeks when covering call, so this doesn't include call at all. It does vary a fair amount, as you can see on the graph. So this graph shows the number of urologists that work a certain amount of hours per week, but the majority are still working more than 35 hours per week. So the graph numbers don't necessarily completely add up to a 10-hour workday, and that's because there were different parts of the survey, and so for this graph specifically, it's considering weekday daytime hours, and that was starting 8 a.m. to 6 p.m. So the maximum amount of hours per week would be 50 within this time frame. So the hours that were reported outside of the time frame of 8 to 6 wasn't included in the total average, which I mentioned earlier from the 7:20 to 5:20. But they're still counted toward the weekly hours, so that's where the averages all come from. So those hours outside of the 8 a.m. to 6 p.m. are shown here. So the vast majority of urologists are working over 10 hours per week outside of what was deemed regular work hours, that 8 to 6. So even for non-urgent procedures, over a third of the urologists in the province are in the operating room after 6 p.m. at least once a week, if not more. And when it comes to emergencies, it's nearly everyone. 86% of people are in the operating room after 6 p.m. So how much are urologists actually operating? So within regular hours, again, that 8 to 6, there was an average for 9.3 hours per week operating as the primary surgeon, and then an additional 2.7 hours per week assisting colleagues or otherwise being in the OR for someone else. For after hours work, which again, this is considered to be after 6 p.m., is about 30 minutes per week for non-urgent ORs and 1.5 hours per week for urgent or emergency ORs. So this doesn't include things like cystoscopy or like ambulatory or local rooms. So to go into that, urologists are spending an average of 4.75 hours per week doing cystoscopy and an additional 1.5 hours per week doing ambulatory procedures, excluding cystoscopy. So these, of course, are averages. As you can see, many urologists are spending over 5 hours per week doing cystoscopy. The cystoscopy suites and local rooms, of course, don't run themselves. And it takes about 2 support staff per urologist to make them happen, according to what people told us. So urologists are super busy doing cystos, procedures, operating. What about call? So unsurprisingly, most urologists are on call 1 in 5 or more. The distribution is there on the right. So when on call, urologists are going into the hospital about 65% of the time, and operating just over half at 55% of the time after hours. So from 6 to 11 p.m. alone is, over 55% of the time. Then after 11 p.m., it pretty dramatically decreases to about 17.5% of the time needing to go into the hospital, with 15% of that time spent operating. So after 11 p.m., pretty much every time you're going in overnight, you're operating, which makes sense. Just under half the nights on call, you guys are being woken up. So for those people on 1 and 2 call, that's 25% of your working life nights in total that you aren't sleeping through the night, which is quite a lot. And that's only to do with work, not taking into account if you have children or other things waking you up otherwise. So the CUA was also interested in urologist workload, and they also compiled some data in 2022 and 2024. They reported that in 2022, urologists were averaging about seeing 65 patients per week. This increased to 85 patients per week in 2024. So for these, telehealth was actually not included in either of these numbers, which is possibly why they seem on the lower side. You can imagine if you included telehealth, those would likely be quite a bit higher. I've seen in some of your clinic schedules that some of you are seeing almost 65 patients per day, let alone per week. So a bit of variance there. In all seriousness, since COVID, telehealth has become a huge part of practice for all physicians. And so the CUA reporting in-person appointments as their metric for workload may not be the most representative thing. So maybe they'll look at that in the future and actually include those numbers as well. So this brings us to burnout. So the WHO defines burnout as a syndrome conceptualized as resulting from chronic workplace stress that has not been successfully managed. So it's characterized by, 3 main dimensions. So these are feelings of energy depletion or exhaustion, increased mental distance from one's job, or feelings of negativism or cynicism related to one's job. And it reduces professional efficacy. So that is what WHO kind of considers burnout as their official definition. In this survey that we sent out, 65% of urologists felt they were burned out. So that is pretty high, over half. 63% felt emotionally drained, and 13% contemplated suicide within the last 2 years. So this is here in BC among you and your colleagues. So these could be people you're seeing every day, getting consults from, working with. A lot of them are burnt out, and some are clearly feeling very bad about things. So according to a study done in 2021 that looked at Canadian data from 2018, nearly 32% of Canadian urologists met the criteria for burnout. So this is about half of the BC average that I just told you of 65% from our survey in 2022. But I should mention that the response rate was only around 17% for the Canadian survey. So it may be higher, but those people feeling extra burnt out maybe didn't want the extra workload of filling out their survey. So among the Canadian data, burnout rates were highest for those who were feeling financial strain. So 50.8% of those who were burned out said it was because they were feeling financial strain. 45.3% were female, and 41.8% were early to mid-career. Americans also noted an increase in rates of burnout since 2016, particularly for women. Burnout, obviously, not only felt by staff, it is also felt by residents. So in 2019 and 2020, the Canadian urology residents that were graduating in those years were surveyed with 100% response rate. So every single resident graduating in these years filled out this survey, apparently. They found that 70% of these residents were burnt out in 2019, and this actually increased to 88% in 2020. So 88% of the residents that were graduating in 2020 about to start fellowship or practice are already feeling burned out before they even set out to start. Where 13% of their new colleagues, at least in BC, we've just learned, have been contemplating suicide around their job. So on that depressing note, there was a positive finding in our survey as well. 88% of urologists feel that they're making a positive impact in patients' lives. So at least some of the 64 and 63% of urologists that are feeling burnt out and drained still feel like they're doing some good for their patients. So are other surgeons just as burnt out as we are? I had a look into it. I didn't look into every single specialty, but as an example, staff orthopedic surgeons in Canada have a reported burnout rate of 27%, according to a paper from 2022. ENT is pretty similar with a rate of 22% in the same year, although that was an American study and included both residents and staff in that 22%. They did note in that study that the ENT residents had a higher burnout rate than their staff, similarly to what was found in the Canadian urology surveys. The Canadian ENT surgeons apparently are also burnt out. One study from this year actually reported that increased workload and exhaustion are making them want to retire earlier than they had originally planned. Though the study didn't comment on specific actual burnout rates. In another study looking at burnout in American GI surgeons, there was a 69% burnout rate, with 81% of the respondents feeling like they were at the end of their rope. So it seems like surgery in general may not be so great for burnout, but maybe we should have considered ortho or ENT a little more seriously instead, since they seem to be doing a bit better than us and our GI colleagues. So what can we do about this? In 2018, the CUA looked into burnout, and 54% of the respondents reported that they wanted better organized resources that they could access. But only 12% of respondents actually tried to access any resources in the first place. So it seems like maybe if there were supports readily available, more people may have tried to reach out and access these services. So that could be one possible place to start. On an individual level, of course, we all know things like having regular exercise, having a good support system, professionally through mentorship or personally with family and friends have been protective against burnout. That's not really anything new. Vacation time has been found to be another protective factor. So in our survey, we actually did look at how much vacation time people were taking, and it is about 5.1 weeks per year currently is what people are taking. But of course, in order to do all of these self-care things that we know are good for us and that we know are protective, we need time and we need access to resources and access to more time to be able to do those things. So I've shown everyone that urologists are mostly working for a lot of hours of their day. So how do we increase time that everyone has to better care for themselves? So one way is to decrease workload. And to decrease workload is to increase those doing the work. It's been projected that Canada will need an additional 16 urologists per year to cope with the increasing and aging population. This, of course, is very dependent on resource allocation for new hires and unfortunately is not necessarily within our control, besides splitting the resources we have among more people, which means less for everyone individually. So existing urologists, like I said, could split their current resources with new hires to decrease their own workload. This does come with a pay cut, obviously. And additionally, or alternatively, things that can speed up paperwork and administrative burden can help to decrease working hours. So one option for this is to use AI scribes for clinic or OR notes, which it sounds like several people have already started incorporating this into their practices, based around prior discussions at like journal clubs and things that I've heard. So we could further that for people who maybe aren't so adept with it yet. Other options require a bit of restructuring of the entire system of what we're doing. So other groups have found that acute care services or consultation teams where allied professionals are incorporated into the urology practices have been shown to increase patient access and improve surgeon satisfaction. So in the team models, there are different non-specialists like nurses or physician assistants who can free up the specialist or the urologist time by taking histories, answering basic questions that you would ask everyone, and doing things like group education sessions. So instead of spending the majority of your appointment counseling around like diet for stone prevention or things for overactive bladder, for example, you could have these group sessions where a nurse practitioner or someone else educated on the subject does it all at once for everyone. So this would leave the specialist or the urologist free to explain things like diagnoses and really important recommendations, go through the procedures in more detail, and do other admin things like their dictations or reviewing pathology, imaging, labs, all of those extra things that take up time. So by paying like a nurse to do some of the tasks that the surgeon would be doing, the surgeon's then able to actually increase the number of patients they see without increasing their personal workload. Another idea that was seen in the literature is to completely rearrange the call schedule. So a group rearrange it to 12-hour call rotations to make each call shift more manageable and allow people to create more balance. This, of course, has challenges and can really depend on call pool size. So to go a bit more into that, this group was consisting of 8 surgeons at a tertiary care center, and they implemented the acute care service with weekly blocks of 12-hour day and night call to try and decrease their burnout. So the 2 surgeons on call for that week, one of them would take the 12 hours during the day, one of them would take the 12 hours during the night for the entire week. And during that week, they didn't have other clinical duties, so they weren't running a clinic, they weren't having OR days, they were basically just taking the call. And after the implementation, something interesting was they actually surveyed the surgeons, of course, but they also surveyed their families and friends at 6 and 12 months. And what they found was basically every measure they looked at improved. The surgeons were feeling less exhausted, they were feeling more accomplished. They had higher perceptions of fairness, their perceptions of their workload improved, their perceptions of community improved. And this was actually also echoed by their friends and family. So they also felt those same improvements over the course of the study. So based on this study, it could definitely be something to think about for some of the larger and busier groups. Obviously, if your call at baseline is not very busy, this would probably mean a lot of sitting around doing nothing and, of course, not billing for anything during that time. So probably wouldn't be the most lucrative or help with seeing all your your clinic wait list, for example, if you're just sitting there doing nothing. But having some time off might also not be a bad thing either. As we saw, self-care is very important, but just something to think about. So that was kind of the basis of everything we looked into and the data. So now I'm just mostly going to summarize some of the key findings and remind everyone what we saw. So unsurprisingly, urologists in BC are very busy. They're working an average of 62 hours per week, not including call. And many of you are doing very frequent and very busy call. Patients are waiting a long time for surgery, especially if it is not an emergency or deemed not urgent. They're waiting an average of 8.7 months. So that means some people are waiting a lot longer. And all of this work, all of the call, the busy long day is leading to burnout. And urologists in BC have twice the burnout rate of the urologists in Canada overall, which should not be discounted. So ultimately, what we need is more of each other, more urologists to do the work. But this isn't something we can really do on our own, and is obviously a very complex issue. So in order to hire more urologists, we need more OR time, more nurses, more cystoscopy time, all of those things together. And these require changes at a hospital level, at a systemic level. So not necessarily something that I myself in this presentation have the answer to. But hopefully now that we kind of know where everyone's at, we can talk about it a bit more, talk a bit about our workload, how we're feeling. If we're feeling burnt out, we can hopefully reach out since we know almost everyone else is also feeling the same way. And we can help ease everyone's workload by helping each other out. So I either talked very fast or put in less than I thought, because that's the end of my presentation. But I do again want to thank Dr. Locke and everyone else for putting the paper together with me and helping with the presentation. So I'll leave it open to everyone.